Trent.
We have a quorum. I move that we go into executive session. Do I have a second? I have a motion and a second. All those in favor say aye. Opposed, nay. The ayes have it. We are in executive session. I move that we bring Senate Bill 818 before the committee. Do I have a second? The bill is before the committee. Senate Bill 818 is my bill that we heard several weeks ago dealing with the rulemaking authority of the Department of Health and Senior Services. I move that we do pass Senate Bill 818. Do I have a second? Any discussion? Seeing none, Mr. Secretary, call the roll.
Esslinger. Brown.
Aye.
Beck. Black. Crawford. Mosley. Trent.
By a vote of 3-1, we have due passed on Senate Bill 818. I now move that we bring Senate Bill 1039 before the committee. Do I have a second? The bill is before the committee. Senate Bill 1039 is Senator Roberts' bill that we heard last week that would establish the Geospatial Advisory Council. I move that we do pass Senate Bill 1039. Do I have a second? Any discussion? Seeing none, Mr. Secretary, call the roll.
Esslinger. Brown.
Aye.
Beck. Black. Crawford. Mosley. Trent.
By your vote of 5-0, you have voted due pass on Senate Bill 1039. I now make a motion to move out of executive session and resume our regular hearing. Do I have a second? We will now resume our regular hearing. We have 3 bills to hear today. We will start with Senate Bill 1251. Senator Crawford, please begin whenever you're ready.
Thank you, Mr. Chair, members of the committee. For the record, Sandy Crawford, District 28. Thanks for hearing Senate Bill 1251 today. Senate Bill 1251 clarifies who has the rulemaking authority dealing with pharmacy services in hospitals. There's been confusion in the past to whether DHSS can set rule or promulgate rules to set the standards for the provision of pharmaceuticals in hospitals independent of the State Board of Pharmacy. And this bill will streamline the jurisdiction by clarifying that DHSS has the sole authority to promulgate the rules governing the pharmacy services in hospitals, but the Board of Pharmacy will continue to maintain its ability to regulate the pharmacists and pharmacy techs. Happy to answer questions. I think I have somebody behind me that can answer in more detail.
Are there any questions for the Senator? Seeing as there are none, would anyone like to testify in favor of the bill? Please come forward. Be sure to fill out a witness form.
Good morning, Mr. Chairman, members of the committee. Bill Anderson on behalf of the Missouri Hospital Association. Appreciate Senator Crawford bringing this bill forward. And it's really a straightforward issue. Our hospitals are currently licensed by the Department of Health and Senior Services. The pharmacies in those hospitals are part of that operation, and so we feel that it's the appropriate entity to be regulating the pharmacies in the hospitals. That's how it had been. It's always been. The reason for this language, back in 2014, there was legislation passed around medication therapy services that created an opportunity for the Department of Health and the Board of Pharmacy to jointly promulgate rules around those types of issues, where it made sense for both entities to have some input there. But it was not intended to make every regulation that needed to address hospital pharmacy services have to have joint rule promulgation. So what this does is gives us clarity that for regulations in the hospital pharmacy related to the direct care of patients in the hospital, Department of Health and Senior Services is the sole authority there, and that the Board of Pharmacy retains its licensure and regulation of pharmacists, pharmacy techs, and all the different types of pharmacies that they regulate. So with that, I'd be happy to answer any questions.
Any questions for the witness? All right, thank you very much for your testimony.
Thank you.
Anyone else to testify in favor of the bill? Please come forward. Anyone that would like to testify against the bill, please come forward. Anyone that would like to testify for informational purposes only? Senator, do you have any closing remarks?
I do not, other than thank you for hearing the bill this morning.
That will conclude the hearing on Senate Bill 1251. We will now hear Senate Bill 1287. Senator Crawford, begin whenever you're ready.
Thank you again. For the record, Sandy Crawford, District 28. Senate Bill 1287 is a bill dealing with dental services in correctional facilities. Current law states that a corporation must be owned by a dentist to employ dentists to provide dental care in correctional facilities. The Department of Corrections contracts out the health care that's delivered to the inmates, including dental. Since the current company delivering this care is not owned by a dentist, they can't employ dentists for the purpose of delivering care to the inmates. Prior to this situation, the corporation that did contract with DOC was owned by a dentist, but just a few months ago, the owner dissolved that company, and the current healthcare vendor for the DOC cannot hire dentists because they're not owned by a dentist. And this bill simply exempts the ownership requirement for the companies that contract with DOC to provide dental care to inmates. I'll be happy to try to answer questions, but I should have somebody behind me that can also answer questions.
Any questions for the senator? Senator Mosley?
Right. So the owner won't be a dentist, but he will be employing actual dentists, correct?
Correct. Yes, it's just the ownership of the corporation.
So I don't know if you have this information, but wasn't there a change made years back regarding other healthcare providers?
I do not know, but maybe one of my witnesses would be able to answer that.
Okay. Would anyone like to testify in favor of the bill? Please come forward.
Mr. Chairman, members of the committee, Jorgen Schlemmer on behalf of Centurion. Centurion is the company that has the DOC contract, and the senator explained it perfectly. Essentially, we used to subcontract with a company that was owned by a dentist to provide dental services in the correctional facilities. There's 22. There's a clinic in each one. And we could no longer contract with that company, obviously, because that company dissolved. We just wanted to hire their dentists. Their dentists were good, but there's this item in the statute that says that a dentist cannot provide services unless it's employed by a company that's owned by a dentist. Now, I will tell you that the dental association, who I visited with, said they don't want to open it broader because it was a purposeful restriction put in the statute many, many years ago because they didn't want what we've seen with some other practices with physicians is corporations going to gobble them up. They wanted to keep the dental practices local and owned local, and that model seems to have worked, so we like this very narrow carve-out. And Senator, I'm not aware of, I can ask the physician groups, but I don't know relative to this change, what might have changed for other physician groups earlier. Yeah.
Any questions for the witness? Senator Mosley?
So do they only contract with one company or?
So, Department of Corrections?
Right.
Yes, they put that out for bid every, I want to say 5 years or so, and several healthcare companies bid on that contract, and my client was the lucky winner.
Mm-hmm.
Senator Beck?
So just to be clear, you're representing Centurion, right?
Centurion, correct?
But you also mentioned the dental association.
So I checked with the dental association. I said, hey, look, here's kind of what I'm doing, because I know that they really like the way the statute is structured. And I said, this is only for this one vendor, whoever that vendor might be with the Department of Corrections, to be able to provide services to the inmates, because they have to have a contract with the Department of Corrections, and they said, we're fine with that.
Okay, I just misunderstood you because I thought you were also saying that you represent the dental association
I do represent
later.
the dental association.
Okay,
but
but not here in this particular. That's what I'm.
sensitive to clear that with them first.
Well, that's why I was just clear why, because we have some cross contamination, as I call it sometimes around here. But,
Yeah, right.
all right,
Yes.
thanks.
Any other questions to the witness?
Thank you.
Oh, Senator Mosley?
Does the company have to be from Missouri or is from anywhere? I mean, you said something about they
Does
had.
the-
What was the little piece you said they changed or run? I forgot. Something about it had to be a company from the state or the country. What did you say? Prior to this, something you said. I can't remember. Never mind.
Yeah, no, I'm sorry. I can't recall that comment either. Okay.
Any other questions to the witness?
Thank you.
Thank you very much. Anyone else like to testify in favor of the bill? Please come forward. Anyone like to testify in opposition? For informational purposes only? Any closing comments?
No, thanks again for the opportunity.
Thank you. That'll conclude the hearing on Senate Bill 1287. We will now hear Senate Bill 1277. Senator Black, begin when you're ready.
Good morning, Mr. Chairman, members of the committee. For the record, my name is Rusty Black, and I represent the 12th Senate District. Senate Bill 1277 deals with the Missouri State Advisory Council on Emergency Medical Services. This legislation will change the current process for the appointment of the members of the State Advisory Council from the governor to the director of the Department of Health and Senior Services. The current State Advisory Council law establishes an advisory committee that defines the various stakeholder groups that should serve, such as paramedics, emergency doctors, EMT, fire chiefs, urban and rural, and from different types of agencies such as ambulance districts, fire departments, private services, and hospital-based ambulance services. This committee has been instrumental in establishing improved protocols and procedures that have been passed by the General Assembly or DHSS via rules and regulations. The State Advisory Council has been a body with members appointed by the governor since the 1970s, but the current State Advisory Council has only 5 active members and has had no appointments made since the Blunt administration. This bill simply allows the director of DHSS to appoint the advisory committee members in a timely manner without going through the Senate confirmation process. Thank you for your time this morning. I'd be happy to answer any questions.
Are there any questions for the senator? Senator Mosley?
So excuse me. What reason are you wanting to change it from the governor to these other entities?
There's going to be at least one, maybe 2 people come up behind me and straighten up anything that I say wrong. The fact that they're down to 5 members that are active, and this group provides the advice whenever rules are written around emergency services. And we listed several, and when you look through the bill, you'll find all the different agencies or areas. They would like to get that staffed, and I don't think anybody's pointing at the last, it seems like 30 governors, I understand that's not true, that have not filled the last 4 or 5. and allow DHS to get these people on the committee so the family can get together and help promulgate those rules. So that, it's not with intent to harm anybody, but it's just, let's get this thing filled back up so they can look over rules. And as we all know, emergency services, for those of you that can't tell I'm old, I can remember emergency services whenever I got tore up, you got thrown in the back of mom's car, and you got there, and now we expect a lot more from our emergency services, right? As we continue to add laws based around those and rules based around those, the people having to take care of those rules want to be in on the discussion before they're put on top of them. I hope that helps.
Any further questions for the senator? Would anyone like to testify in favor of the bill? Please come forward.
Chairman, members of the committee, my name is Brent Tempill. I'm here on behalf of the Missouri Ambulance Association. We're primarily comprised of hospital-based EMS, ambulance districts, and a few for-profits. Yeah, we've asked the senator to bring this bill forward. We have gone through literally a year since we've had new people admitted to the State Advisory Council on EMS, and this committee is wonderful about vetting ideas before we bring it to you, the legislature, or take it to DHS for promulgation of rules. And it's comprised of the fire service folks, as well as EMS and hospital-based and healthcare, physicians, ER docs. And we literally have 5 people, I think, in the current makeup. One is of the vacancies is deceased. Many of them are retired. The current group of the 5 are all in their later years looking towards retirement, and we're just trying to bring younger blood into these appointments. It is purely and only an advisory committee. It has no statutory authority to promulgate rules or statutory changes whatsoever. So we're just trying to streamline it, give the director the ability to get these folks appointed.
Any questions for the witness? Senator Beck?
So my questions are, so I think 14 different associations, so, but there's 23. So what's the makeup? How does that breakdown come, you know, I mean, as
Lay
far
people?
So I'm assuming the 14 are coming from these
Correct.
associations?
Yeah, so if you, and you probably know this just being around here, we have a lot of folks in EMS. We have Firefighters Union, we have the Fire Chiefs, who's behind me, ambulance, we have hospital-based EMS services, we have ambulance districts, we have ER docs, and so we just wanted to ensure a voice at the table, so that's why we list those organizations, because there are quite a few around the state that we just think should have a seat at the table when these conversations are going on. And we just specifically list them to make sure we don't exclude anybody.
Okay. And the other thing I was curious, I know I see what was deleted from what it used to be. Do we recall why there was, there had to be a resident from the city of St. Louis before, and now you don't do that anymore?
I have no idea. If you want to ensure that, that's...
Well, I don't represent the city of St. Louis, but I was just curious why
I do
that,
not know, Senator.
if you knew maybe the history why it was in there or why it's not in there.
I don't.
Okay, thanks.
Any other questions for the witness? Mr. Mosley?
Are there going to be any?
Hold on.
Sorry.
Are there going to be anyone from the public on the board?
Say that one. Anyone.
A public member for the appointed?
I would welcome that amendment if they're willing to serve. Absolutely. We want a people. This is a great vetting of controversial issues and not controversial issues, just to have it discussed before we take it out here to the legislature or go through the rulemaking process. And if there is a legislator willing to serve, I have no problems. I think they could fit one of the other appointments that are open besides the actual associations listed. But yeah, that would be great.
And all the people, those organizations you named, those will be the ones who will be on the board?
A member from one of those organizations appointed by the director of DHSS, correct.
Okay. Is there going to be some type of, what kind of diversity are you going to require?
A lot of times we have to beg folks to do this. It's obviously time consuming to go and come to Jeff City and go through these meetings. I would assume each of the groups listed would be willing to put forth or search out somebody who is willing to serve and would be good at serving on that advisory commission. The others, I would leave it up to the director and he or she's abilities to pick right people to serve on that SAC board.
Ain't gonna be diverse at all.
Any further questions for the witness? Thank you very much. Anyone else would like to speak in favor of the bill?
Mr. Chairman, Jorgen Schlimmer again on behalf of the Missouri Fire Service Alliance. This is an entity that you want filled, robust conversation, because I think I might change one word that Mr. Hemphill said. He said these are controversial issues. They are, but they're also very complicated issues. And instead of trying to vet all of the clinical issues that an EMT or a paramedic or a community EMT or in an ambulance district and fire district and this oversight, let the experts all figure that out. Let them come up with what they believe is the best for the consumer and the patient and the system and the industry, and then present a plan to you all instead of all of us coming up here individually and telling you about our ideas and expecting you to go then write a solution for us. So I think it's a committee that has worked well for 30 years, and we just want to help the governor with his appointment process and get those appointed a little bit more quickly and take some things off his plate. Or her, whoever it might be.
Any questions for the witness? Senator Mosley?
Well, this would be I just really have a comment, not a question, but this would be great if those organizations were more diverse and had more African Americans in their organizations. That's all I have to say.
Thank you.
Any other questions to the witness? Thank you very much. Anyone else that would like to speak in favor of the bill? Anyone that would like to speak in opposition? For informational purposes only. Senator, any closing remarks?
Yeah, I'm afraid I do. So everybody hold on just a second. It's going to be about you, Senator Beck.
Senator, you told me you don't even like coming to committee meetings, and now you're going to hold me here for another minute.
It won't be very long, and I'll get you in pretty quick. Years ago, before I came down here, I helped with advocates start a committee called the State Career Technical Education Advisory Committee that Senator Beck sits on. Senator Esslinger has been on. I can't remember whether Senator Crawford's ever been on that one or not. Once in a while, Senator Beck and I have to remind that group, you're still advisory. So once in a while, they think they're making all the decisions and they're the dictator. We have to bring them back. But it's a very good group to vet, just what we heard, to go through and keep us informed. You know, if some legislator does want to be on there, I see lots of positives about trying to get this done, and I don't think anybody's trying to slip anything in, and serving on those committees and advocating for them. It's a good idea, folks. Let's get this done. Thank you.
Thank you, Senator. That will conclude the hearing on Senate Bill 1277. With no further business coming before the committee, I make a motion to adjourn. Do I have a second? We are adjourned.